I am a pharmacist, and I have been a pharmacist for close to 35 years. And as a pharmacist, I have always been intrigued by my tribe. The fact is that when you are a member of a profession like pharmacy, the public, your family, your friends, your patients, other colleagues you work with, have some preconceptions about who you are, what you do, and what you can contribute. Understanding what those preconceptions are and understanding how those may influence our day-to-day work as pharmacists is an area of research interest for me. The question of professional identity is a really important one, and until recently, it wasn't something that anybody really thought very much about. In the research that has examined how pharmacists think about themselves, the words that most frequently come up when we ask pharmacists, "Tell us about your profession," are words associated with tasks. Pharmacists will say things like, "I dispense medications," "I educate patients," "I provide advice to physicians." They tell us about the specific jobs they do. They don't necessarily explain the role, the responsibility, or the value of what they bring to the healthcare system. The fact that pharmacists, when asked to describe themselves, focus specifically on jobs rather than values might be an interesting clue as to what we really think about our profession. Why pharmacists may not have a fully formed professional identity and instead think of themselves in terms of jobs rather than responsibilities and the value they bring, that's a really complicated question that we are only now starting to examine. I suspect it could be because historically, pharmacy as a profession has seen itself as subordinate to other professions, specifically medicine. We have seen ourselves as helpers, assistants, somebody who is one step removed from the action. That kind of supporting role, of course, has value, but it also sometimes requires us to put ourselves and our own interests in the back seat. So in my research program right now, we're trying to explore the question of why is it that pharmacists' professional identity may not be as fully formed as it could be. If we are to address this complicated issue of professional identity, we are going to need the profession as a whole, employers and workplaces, but also each of us as individuals to figure out how we can all work together to ensure we're aligning our efforts to adequately and fully explain to the rest of the world why we matter. A little bit of self-reflection, a little bit of appropriately proportioned self-promotion, but a lot of emphasis on what the profession does for the public is what will be needed to really help our own self-identities evolve. Within the university, we take a lot of time and a lot of effort to try to help our students be prepared for a model of pharmacy practice that may not exist today, but we expect will rapidly evolve in the future. People my age will oftentimes say, "Why, when I graduated from school, all we ever did was count in multiples of 5 and put things in bags and hand prescriptions over to patients and never tell them anything." But today we're supposed to be involved in patient education, assisting patients in self-care decision-making, and advising physicians about appropriate prescribing. This is a major issue we need to contend with, the disconnect between what leaders say pharmacy should be and what's actually happening. In part, I think it's because we haven't yet done a good job convincing the profession that it matters as much as it does. As human beings, but particularly as the kind of human beings most pharmacists are, we probably rely a lot, if not too much, on external validation. We are going to start to believe how important pharmacy is only when patients, physicians, nurses, the general public, governments, and employers start to tell us that. We need to find ways of believing it for ourselves first, and then living it on a day-to-day basis with every patient who comes through the door.